Welcome back to Drug Talk, everybody. Garrett Campbell here. In today's video, I want to share with you a couple important things you should know before discontinuing an antidepressant. So discontinuing an antidepressant can mean different things for different people. Some people may stop an antidepressant because they're going to start a new medication. Other people may feel like they've reached a point in their therapy where they no longer need their medication at all, so they're just stopping it completely. And then there are some people like myself who just use a medication during certain times of the year. I use Wellbutrin to treat depression associated with bipolar disorder from October to March, and then I stop the antidepressant at that time. Whatever the reason is that's causing you to stop using your antidepressant, there are a few important things you should know. Like the first, make sure that your physician and your pharmacist, really your whole healthcare team, are aware that you're stopping your antidepressant. One reason this may be important is that if you're using other medications and you stop using your antidepressant, there may be changes that have to be made to those other medications. It's also important to let your healthcare team know because some members of that team may want to monitor you more closely for symptoms of worsening of depression after stopping the medication. Another important thing to know when stopping an antidepressant is not to stop it abruptly or cold turkey. One reason for this is that some antidepressants may cause withdrawal symptoms if you stop the medication too quickly. A good way to avoid this is to make a plan with your physician or pharmacist, really both of them, to make a plan to stop the medication more slowly. This kind of relates back to the first reason that we talked about letting your whole healthcare team be aware that you're making this decision. As an example of how to stop a medication slowly, again, this is just for information purposes only, just my own personal example, but when I use Wellbutrin, I get up to a dose of 450 milligrams. And then when I know March is approaching and I have to get off the medication for the springtime, I will go from 450 milligrams down to 300 milligrams for 2 weeks, and then down to 150 milligrams again for 2 weeks before stopping the medication completely. And the last thing you should be aware of before stopping your antidepressant is that you should really get in the habit of self-monitoring. It's important to self-monitor after stopping an antidepressant because you may experience worsening of symptoms of depression, and you may want to have a meeting with your physician or pharmacist to talk about starting a different medication or restarting the antidepressant that you stopped. When I got in the habit of stopping the medication annually, the antidepressant that is, I found it very helpful to keep a journal so I could document my withdrawal symptoms I was experiencing or a worsening of depression that I experienced. This way, when I went to see the physician months later, I had a good note of what exactly was going on, and I could give them the full picture so they could make an informed decision about my treatment. To finish off here, just remember that there are lots of different antidepressants out there, and it can be very difficult for some individuals to find the right antidepressant for them. So don't give up after 1 or 2 antidepressants. For me, for example, it took 4 antidepressants before I found Wellbutrin, which was the right one for me. I just wanted to put that out there so that you kind of give it a chance before you give up on these medications. Also keep in mind that antidepressants can take some time to reach that max benefit. Sometimes it can take up to 2 months. So if you're just starting an antidepressant, it may not be the best idea to stop it early in treatment, but maybe to give it a couple months and give it a fair chance to see if it will work for you. All right, everybody, that's all I wanted to talk about today with stopping an antidepressant. Take care.